A certified medical assistant is a role that supports the physician, the nurse practitioners and physician assistants, and work alongside nurses to support patient care and the clinic setting. Here at Medical Associates, we utilize the certified medical assistants to help us room patients, to take medication histories, do a set of vitals, discuss with the patient why they're here, get the patient ready for the doctor. At the desk, they're doing things like refilling medications, reviewing histories, assessing what needs to be done in the department, talking to nurses about what they need to do for patients, and keeping an eye on the schedule to make sure that the day flows smoothly.
So I was in high school and I knew that I wanted to be like in the medical field, like a nurse somewise, but wasn't really sure what I wanted to do. You know, growing up, I thought that I wanted to be a pediatric oncologist, and that was way far up on the scale. Kind of looked into what I wanted to do, found the CMA program at NICC, knew that it was only going to be a year, and I was like, you know what, that's manageable. It was a hard year, but it was definitely doable. So I did that, and knowing that it was only 5 days a week, no weekends, no holidays, and I got to see kind of what it would be like to be a nurse, but not necessarily be a nurse, and be around those people as well too, to know that if you wanted to be a CMA and then you wanted to go on to be a nurse, you could know what kind of you were getting into.
I decided to apply for the scholarship because within a matter of days of not even knowing what a medical assistant was to experiencing the patient care that I was given and finding out what a medical assistant was, it kind of checked all my boxes of what I wanted in a career, like every single box of what I wanted. So it kind of sounded like my dream job, and that's why I decided to apply.
Well, it was actually quite interesting. I was a preschool teacher and I was kind of feeling unfulfilled, and I wanted to have a career versus just having a job. And I had quit my job there and wanted to get back into the healthcare field. I didn't know how or why. I just happened to go on Google and search, and Medical Associates Medical Assistant Scholarship Program popped in my face. So I kind of feel like the program chose me. And then I went for it, and I did the interview, and I got in, and it has been the biggest life changer.
The value of the scholarship is actually up to $11,000. The scholarship is 100% fully funded, and it covers the tuition. There's 2 semesters, so it covers that and all the textbooks, and at the end there's an exam that you'll take. It covers all of that. My advice for someone who's considering to apply to the CMA program would be to really explore what your interests are. So if you're someone who has strong customer service skills and you've been thinking about going into the medical field and you're not quite sure how to go about that or what that looks like, or maybe you're not quite sure if you want to go into different sectors within the medical field, this is a great opportunity, and you should consider applying because it's 100% fully funded. The other thing I would recommend or give advice on is to explore your support system. It is important that you can really delve into the program, and it is about just shy of 12 full months, and we do encourage you to work no more than 20 hours so that you are really set up for success. So that might mean that you need to explore what kind of support system you have in order to be able to work or to go to school full-time, and limit yourself to only working up to 20 hours.
The students get to learn anatomy and physiology, medical terminology, medical law ethics. They get classes that are in pharmacology related to medication management, first aid, how to work closely with patients, patient relations, and a lot of computer skills. The program is 12 months long, and at the end, the last 240 hours are clinical rotations here at Medical Associates within the departments. So the student gets to experience what it's going to be like once they begin as an employee while they're still in school. That 240 hours, you could be in many different departments, and you could be doing things such as front office work and learning about insurance and coding, as well as rooming patients and doing all the stuff in the back clinical area that's needed.
Upon our completion of our coursework at NICC, we came to the clinic, and for about 240 hours worth, we are sitting side by side with a preceptor in either a specialty for a couple of weeks or in a general practice like family medicine per se. And what we do is hands-on knowledge, literally sit there, watch our preceptor do what they do best, work with patients, work with providers, and after a few days of being comfortable with that, then we're able to work with patients and providers, obviously being observed by our preceptor and being watched closely. But it's a really good time to ask all the questions, get all the answers that we need, and kind of work the kinks out. And it's basically on the job training to get your foot in the door.
Well, during my clinicals, both rotations I did in internal medicine, because in the middle of it, there was a position that became open in internal medicine. So I feel being able to do that clinical rotation in the department that I got hired in was a big plus, because it prepared me for what I would be doing every day.
Well, my mother-in-law, my father-in-law, and my husband were very supportive in my decision. So anytime I needed any help, I vocalized any concern I had with them ahead of time, and they really held me accountable and offered the help without even me asking. So without their support, there's no way I don't think I would have been able to do it. I had a lot of discussions with my husband for setting up goals and financial planning, that we were lucky enough to be financially stable enough, and he was supportive enough to help me reach my goals and to apply for the scholarship. So anytime I did need any help at all, or to cut down my hours, knowing that he was on my side with my decision making made it a lot easier. But I did have to stay on task. And I did have to ask for help a couple of times from my instructors and classmates and family members. I was a licensed cosmetologist for the past 15 years, and the past 10 years I have been a licensed cosmetology instructor.
Before I attended the CMA program, I was a preschool teacher at a daycare here in town.
Well, you are guaranteed a job. Upon graduation, you will be hired at Medical Associates as a medical assistant, and once you complete the exam with the AAMA, you will be a certified medical assistant here at Medical Associates. The requirement is that you work here for 3 years as a CMA after graduation. The way we set people up for success is a thorough orientation, a lot of one-to-one time with experienced, highly qualified nurses and CMAs to teach the job, to show you the ropes, to help you familiarize yourself with working closely with doctors. We also stay in close contact with NICC until students pass the exam. They're wonderful about giving help as far as giving tests that you can practice on, as well as support needed until you finish that final exam. Human Resources does a great job of staying involved as you're onboarding, which is very important, and the managers are very helpful and excited to have new CMAs here at Medical Associates.
Well, I will say that it's probably the best decision that I've made my whole life. I truly appreciate the intelligent minds that I'm able to be around every day, the empathetic hearts that I'm able to be around. I I've noticed that they've applauded any achievements that I've had, and I enjoy walking into Medical Associates every day because the culture that I fell in love with as a patient is the same culture that I fall in love with every day when I come to work, and I get treated as if I'm a patient, brand new person here. Good greeting, and it's a great work day. The day flies by because of the people that I get to surround myself with.
Working at Medical Associates as a CMA, I would say is exciting and fulfilling. I absolutely love my coworkers that I work with, the doctors that I work with. Giving patient care daily is something that I truly enjoy. I like giving to patients, but then I'm also receiving some great learning experiences from each patient.
I describe it as such a great facility to work at, and my favorite part about it is they have so many different departments. So my favorite part about it is I work in family med, so we get to start with everything. We get to diagnose those patients, we get to refer those patients, which is my favorite part about my job.
Oh, here at Medical Associates, we have a lot of departments that work closely with our CMAs. OB and gynecology, ENT, oncology, physical medicine, orthopedics, ENT, urology, primary care, family med and internal med. And along with family med, we have family care networks. So in some of the satellite locations where they have a family practice clinic, they have CMAs that work in the departments. So the great thing about coming as a student is you can see what departments you really like, get a great experience, and then help you decide what's the right fit for you.